Hi, June. Thanks for joining me today. I will go over what we found in your speech assessment data, explain what they mean, recommend one short follow-up test, and then show you an exercise we will start practicing. You mentioned that since your stroke, your speech feels slower and sounds a bit slurred. That's exactly what we noticed too. When we looked at how your mouth and tongue moved, the right side moved a little slower and felt weaker. This means the nerves that control those muscles were affected by your stroke. In the task where you repeated po, ta, ka as quickly as you can, your speed and precision were slower than typical. That tells us those muscles don't move as fast or strongly as before. In the task where you prolonged you reached about 15 seconds, a bit shorter than the average for men your age. That means your breath support for speech doesn't last as long, and your voice may fade earlier in a sentence. When I listened to your speech sample, your voice sounded a bit breathy and soft, and you seemed to use a lot of effort to get the words out. This shows that speaking takes more work because you don't have enough steady breath support to keep your voice strong throughout each sentence. All of these signs together show that these muscles you use for breathing, voicing, and articulation are weak and move more slowly. This pattern fits with a flaccid dysarthria, which is the speech change caused by damage to the nerves that control your speech muscles after stroke. People with this type of speech pattern often sound slightly breathy or soft, may lose air through the nose, and produce some consonants less clearly. It's important to know that this affects only how your muscles move for speech, not your thinking or understanding. Your strengths are also clear. You understand everything well, follow instruction easily, and stay motivated. This strength will really help you make progress. To help us better understand how your breathing and voice work together, I'd like to complete one short follow-up task where you hold an sound and then a z sound for as long as you can. In your earlier task where you held you ran out of air quickly and your voice sounded slightly breathy, which suggests you may lose air too fast or that your vocal folds aren't closing tightly. This additional check will show us whether the main issue comes from the breath support or from voice closure. It will also be an easy way to track our progress once we start breathing exercises. Based on everything we found, the first treatment I recommend is diaphragmatic breathing. This exercise strengthens the diaphragm, the main muscle under your ribs, so you can take deeper, more controlled breath in your speech tasks. Your breath support was short, your voice was soft and breathy, as well as speaking for longer periods is tiring for you, which means your lungs and breathing muscles aren't providing steady air for speech. Diaphragmatic breathing helps you take fuller, lower breath and release air slowly, giving you better control and louder, clearer speech. Because your goal is to speak comfortably and confidently at work, improving breath support should make your voice stronger and less irritable. Research shows that diaphragmatic breathing exercises improved respiratory function in individuals post-stroke, which strengthens stronger breath support for louder, steadier speech. So it's well supported by evidence and directly matched to your needs. Okay, now let's try it together. Sit up straight, put one hand on your chest and the other on your belly. Breathe in slowly through your nose so your belly moves out while your chest stays still. Hold it for 1 second, then breathe out slowly while saying a gentle, steady ah. Try to keep the sound smooth and even. Now, give it a try. Good job. We will start with 5 of these breaths twice a day. Each week, we will check how long and how strong your sound is to see your progress. That's all for today. Thanks for listening.